about eczema. So, talking about passionate, actually, it's because I have eczema. So my two boys also. So later I will share more on this. Okay. So eczema is the name for a group of inflammatory skin conditions that cause itchiness, rashes, dry and scaly skin, blisters, and skin infections. So there are a total of 7 different types of eczema. Of course, we do not have the time to do so many today. So today we will just focus. I will just focus on the most common eczema, that is atopic dermatitis. So many will still call this eczema in short. Sorry, just a moment. Okay, so in Singapore, eczema in babies and children, as we all know, is very common. So almost 20% of the children in Singapore has eczema, which means 1 in every 5 has it. And even though it's more common in children, but for adults, it's also pretty common. It's 1 in 10 adults suffering from eczema. So eczema can begin during your childhood times or adulthood, and it can range from mild to severe. Okay, so next, how do we know if we have eczema? Elaine, I think you need to switch to the next slide. Okay, so what are the symptoms? In infants, you will usually see the dry red patches, maybe on their face and scalp. So it can also appear on their arms, legs, back, and chest. So newborn babies, they can experience eczema within the first few weeks or months after birth. In childhood, it usually affects the skin folds area, such as the elbow bands, this area, and the back of the knees. So usually it will start in these areas and slowly spread to the other parts of the body. It may also occur around the lips and even the eye areas. So young children with eczema, right, they can experience patches of skin that are extremely dry and very itchy skin that can lead to blisters and skin infections due to their excessive scratching. So the main symptom is itch. So itchiness is usually worse at night when they go to bed, because there are a few reasons why it's more itchy at night. Firstly, the skin moisture levels will decrease at night, and then making the skin more prone to itching. And another reason is, like, in your sleep, right, scratching can happen subconsciously. So when skin is scratched during sleep, it can lead to more itching. Often the more you scratch, right, the greater irritation it can become. So it creates this vicious cycle. So at night, right, you scratch a lot more. And now let's talk about the severity of eczema. So in mild eczema, it's just like some dry, red, itchy patches, right? Then while in very severe ones, right, there will be like the oozing of pus and the crusting of skin, where the pus or skin cells, right, form this rough, scaly, flaky layer over your skin. And worst of all, the bleeding, because it happens when you scratch too much, because of the itch, and because the skin is so dry, right, it cracks very easily. So, what is the cause of eczema? Uh, the exact reason for the cause of eczema is actually not known. So, but some of the most common causes um, are a family history of eczema, having an overactive immune system, and being exposed to certain environmental triggers and stress. Okay, so let's talk about the first one. So eczema tends to run in families, meaning it's genetic. Okay, so this is a picture where you can see the normal skin versus the skin of an eczema patient. So according to the National Eczema Association, people with eczema, right, they have a mutation of this FLG gene. Okay, so this gene helps to produce filaggrin proteins. You can see the structure is a bit different. So on the left, right, you see more of the proteins. Okay, you see it's like filled up, right? Then on the other side is very sparse. Okay, so this filaggrin proteins, right, is very important to our epidermis, which is the most outer layer of our skin. So when there's a mutation of this FLG gene in people with eczema, right, that means they produce a lesser filaggrin protein. So it cause this filaggrin deficiency, and this will greatly affect the structure of the skin's epidermis. So in fact, it was found out that over 50% of severe eczema sufferers, they have these genes that causes filaggrin deficiency, so making it one of the leading causes that contributes to eczema breakouts. So everyone knows that the primary function of the skin is to act as a protective barrier between our body and the environment, right? So to prevent the entry of the pathogens. So, but do you know the epidermis also acts as a barrier to help minimize water loss? Okay, so it prevents the pathogens from coming in, but also preventing our moisture from going out. Okay, this is why people with eczema, they have very, very dry skin because the moisture on their skin, right, it will evaporate more easily. And at the same time, this also allows the allergens, perspiration, and other pathogens to enter, thus making your skin very prone to irritation and infection. Then it causes a lot of itch and inflammation. So additionally, researchers think that eczema could be triggered by an overactive immune system. So once allergens or other substances are inside our body, right, our immune system will normally react. So when it reacts, right, it sends out an army of white blood cells that release chemicals and other substances to destroy the invaders. So these substances are responsible for the skin's inflammation. They are doing their work, but it causes inflammation. So our immune system produces inflammation, or what we call a flare up. Like those people with eczema, we usually term it as flare up on the surface of our skin. So creases of the skin, as I mentioned just now, right? Like the children, they always start from the creases of the skin. So especially the flexural areas, okay, behind the knees, elbows, and other areas of skin that rub against each other. So you notice this movement, right? They rub against each other. It will lead to irritation and also produce an inflammatory response as well. Yeah. So okay, next about triggers, okay. So what makes this eczema flare up? Okay. One thing to note, a trigger is not something that causes the eczema. That means you must have this eczema first, the genes like I said earlier, and the over because of the reaction of the immune system, then it will cause eczema. So a trigger is not. A trigger can cause it to flare up or make a flare worse. Okay, so many have said that the environment conditions are causes too, but actually the correct way of saying should be the environment conditions are just the triggers for the flare-ups. So without the main causes, right, like I said, the genes and the overactive immune system, these factors will not cause eczema, okay? So next, the most common triggers are substances that irritate the skin. So like maybe the dust mites, okay, and the dryness of the skin caused by the soaps, cleanser, and chlorine, or maybe your extended exposure to dry air, extreme heat or cold, laundry detergents and fabric softeners with all the chemical additives. All these will trigger, okay, trigger. Okay, so also the stress part. Emotional stress, as we all know, is very bad for health. So it can also trigger an eczema flare up. So sometimes being unwell also, like if you're having a cold or flu, you're not feeling well that day, or you're having skin infections with bacteria or viruses, can also trigger a flare up. Yeah, so everyone will have different kinds of triggers. So talk about the myths, okay? So atopic dermatitis, eczema, isn't contagious, so you cannot spread eczema to anyone, okay? And food allergies, because a lot of people will say, oh, you shouldn't eat this and shouldn't eat that. But actually, food allergies don't cause eczema. It's rare for food allergens to cause eczema. And also, eczema is not an allergic reaction. Okay, so allergic reaction is like maybe something you ate, right? Then you suddenly have this reaction. But eczema is just because, like I said, the genes and the overactive immune system. So it's not something you're allergic, then you suddenly have eczema. Okay, so there are a large number of children who have eczema also have food allergies. But it doesn't mean that their common food allergens such as dairy, eggs, and nuts would trigger eczema or even make the flare worse. So it won't actually interfere. Okay, so next is also like the title for our today's topic, right? Is there a cure for eczema? No. At present, there's no cure. So it sounds sad, right? But okay, don't worry. I tell you more, okay? Okay, so firstly, we can improve the condition. Okay, we can try to maintain it and maybe don't make it flare up. Okay, so the next slide, Okay, how can we improve eczema conditions? First, Elaine, you need to, yeah, okay. Okay, first we need to avoid scratching, okay? Obviously, right? Because we don't want to break the skin, we don't want it to bleed, okay? So avoid the scratching and avoid the triggers because like I say, everyone will have different triggers. So you really need to find out what kind of triggers actually make you flare up, okay? Then next we have to moisturize our skin very frequently because like I said, lack of the um because of the lack of the filaggrin proteins, right? It's very, very dry. So you really have to put on moisturizer as and when you feel it's dry. And of course, because I kept mentioning about the overactive immune system, so of course we need to achieve a well-balanced immune system. So like I mentioned earlier, the main causes, genes and an overactive immune system. Since we cannot alter our genes, so I realized that the best thing that we can do, right, is to improve our eczema conditions is to try to achieve a balanced immune system. So how do we do that? Okay. Through the study of NI, nutritional immunology, we learned that in order for us to achieve a well-balanced and healthy immune system, we need three main nutrients. Okay, so that is phytochemicals, antioxidants, and polysaccharides. So these three disease-fighting nutrients, right, can definitely help people with eczema to balance their overactive immune system and so that it can reduce our inflammation effectively. So speaking of which, right, it's not just, I tell you all this, I got proof, okay? I got a testimonial to share also. So speaking of which, I also like to share a short testimonial about my younger boy because just now I mentioned I have actually a mother of two. So my younger one have quite bad eczema flare-ups, okay? So he has been suffering from eczema for almost 1 year. And this was taken, yeah, in May, 12th May. So you can see the discoloration, right? Because of the inflammation, right? It's so red. So every time I see him, right, it's like really it's heartbreaking. Yeah. And because it's very, very itchy, so he was scratched until there are a lot of cuts, yeah, on the skin. So it's very painful. So he will actually cry when he goes for a bath, yeah, because the water touches it, it will burn, it will sting, right? And also even cream when you apply, right, it will also sting when there are so many open wounds. So I was very glad that I made the choice to let him try the complete nourishment series from Elite. So about 1 to 2 months, I could see a very big improvement already. Okay, so this is before, right? Okay, now let's take a look at 1 month later. Just 1 month later, it actually cleared up a lot. You don't see any inflammation anymore. It's not that red. And yeah, you can see it for yourself. It's a very big difference. So the inflammation really come down a lot. So as I say, if we can use the right nutrients to treat it, it can actually bring the inflammation down a lot. Okay. And of course, you need to apply the moisturizer constantly as well. So I'm really grateful and thankful to Dr. Chen for the wonderful Elite products. So I would highly recommend anyone with eczema problems to try the products. And with this, I've come to the end of my sharing. Thank you all for your precious time and good night to all.
All right, thank you.